In this video, I'll review concepts from Chapter 28 of Human Anatomy and Physiology, 11th edition. This chapter focuses on development and birth. In particular, we'll look at some of the events that lead to the first breath of a newborn, as well as some techniques of assisted reproductive technology, such as IVF. At 1 and 5 minutes after birth, infant health is going to be assessed. So this is just standard procedure. And this is going to provide for an APGAR score. APGAR scores are calculated by giving 0 to 2 points each for the appearance of the baby, so that's color, the heart rate, that's pulse, reflexes, which is the grimace response, muscle tone, also known as activity, and respiration. An APGAR score of 8 to 10 is a healthy infant. So scoring for 2 for color, 2 for heart rate, 2 for reflexes, 2 for muscle tone, and 2 for respiration is a perfect score. The infant's first breath is going to be stimulated by the buildup of carbon dioxide in its body. This buildup is going to occur because the CO2 is no longer being removed by the placenta. So the buildup is going to lead to acidosis in that baby. Acidosis will stimulate the respiratory control centers, and those control centers will stimulate the contraction of the diaphragm, leading to the first inspiration. It's important that the surface tension within the alveoli of the lungs is as low as possible to allow for the lungs to actually expand. This means that there needs to be this substance called surfactant being produced in the alveolar fluid to reduce the surface tension. If that is the case, which is the case, say, after 25-27 weeks of development, inspiration will occur. Inspiration is, because of the lack of surfactant, inspiration is actually quite difficult in premature infants under 5.5 pounds. Switching gears a little bit, we'll talk about one form of assisted reproductive technology called in vitro fertilization. It is the most common form of ART. IVF includes surgical removal of oocytes after hormone stimulation. Those oocytes are then fertilized with sperm in a dish, and then the resulting zygotes are returned to a uterus. This has allowed, over the past 4 decades, has allowed pregnancy in cases where that pregnancy was no longer possible. There are disadvantages to IVF, however. It's quite costly, it can be extremely emotionally draining, and it can be literally painful for the oocyte donor. I'll leave you with a question. An APGAR score of 5 would indicate a healthy infant. Is that true or false?